What's going on, everyone? Sid Gordon here with the Sid Gordon Podcast, powered by Core Medical with my boy, Mel Chancey.
What's going on, everybody?
So, Mel, today, a lot of times we have these podcasts, and we have different walks of life. And today, this is going to be Core Medical specific. This podcast, we're going to be talking about things that we've seen change in the industry over the last, I don't know, even 6 months or so. And one of the biggest concerns that I have actually stemmed from an event that I was at last week in Arizona. The Arizona Gang Investigation Association, amazing event, 1,100 people. Jeff just put on a great show. Jesse, hats off to you. Actually got this shirt there, and then State 48 hat, pretty cool. But we probably spoke to over 400 people out of the 1,100. Our booth was like 4 people wide by 4 deep. As we always do, give away T-shirts and stuff. Yeah. And Colton and I had the opportunity to actually kind of get out in front and speak with people. Alex was, signing people up and so on and so forth. We probably signed up 200 plus people. But one of the biggest concerns that we saw was out of all the people we spoke to, about 70% were already on TRT, which is great. Mm-hmm. Out of that 70%, 90% were not on any supporting medication whatsoever.
It's amazing.
1 shot of TRT a week. One guy was prescribed 2 cc's a week with no supporting. And I looked at his trailing last 2 blood works, and his estradiol is at 127, and the doctor was not addressing it.
And I want to remind everybody, 127, the top of the range is 44. So,
And we like to keep it between 20 and 30.
It's a sweet spot. I was going to say 20 and 30. So that top of that range, just think of how much that testosterone was converting to estrogen on this guy, and no supportive meds, no anti-estrogens there.
So this is where the concern is. Listen, we know there's a lot of people out there that might be over the age of 50 that just aren't concerned about atrophy in their testicles, don't want to have kids, and don't want to take an enclomiphene or HCG,
Right. I get it.
Which sometimes that's okay.
Yeah.
I'm a big believer in HCG. I just take a minute dose every week. But when there are people that don't convert and don't need estrogen blockers.
Yes.
But the fact of the matter is that 90% of these people, and they looked bloated, a lot of them. I could tell right away they were holding a lot of water in their face.
Yep.
From being in this business so long. I mean, you as well. We can look at someone and tell. And going on testosterone is a very serious commitment, because it's a commitment you're making for a long period of time, right? Yep. And doing it properly is very important. So even if it's not with us, whoever it's with, make sure that you are looking at the components involved and what testosterone does to the body. And I'm going to let Mel kind of go through the entire process of how testosterone works, dialing estrogen, sex hormone binding globulin, and then we're going to get into some other medication.
Yeah, and this is what I preach to us men. You're taking testosterone, right? And like you said, the 1% don't convert, and they're perfect, right? They don't convert. They take their 1 cc of testosterone, they're picture perfect. But the 99 that are like myself need that estrogen blocker a little bit. So your testosterone, you're taking testosterone, it's raising. The body has to keep a balance with estrogen, guys. And if you're not taking something to suppress that, and that estrogen's building up, you get an estradiol of 100. I mean, it's just sky high. It's taking the gains away from the testosterone. You're not feeling the benefits of that testosterone. Sure, your overall testosterone is going to be good. Your free testosterone is going to be good. But the estradiol is sapping that feeling and them gains 100%. You made a good point. You said with FSH and LH in the testicles. I'm 55. Some guys think like, I don't care about that if the shrinkage or something like that. But that little bit of HCG or enclomiphene is like throwing a little bit of nitrous in the tank, right? It just gives you that little boost. It gives you that energy boost, nice little libido boost. You're going to know the difference in taking it.
And then how about what the difference is of being estrogen dominant versus testosterone deficient?
Right. So we see a lot of people that come in, they're low testosterone, let's say, 200, 250, 300. 400 if you're in your 30s is still a lower number, right? The range is up to 950 these days, right? So it's a little lower number. But when you are estrogen dominant, and we see that 60, 70, 80, 90, 100 in case like that, boy, I mean, you're going through the murky waters. You're going through the blues because men, testosterone dominant, women, estrogen dominant, and they convert just like we do. But all the side effects are there.
Well, the other side of it too is you can not be on testosterone and have higher estradiol levels.
100%.
And you know, why does that happen? And why is it happening more common?
Well, we see it now. I always talk about because of the foods. Our foods are loaded with hormones, right? So why are we seeing? And we're very strict here at Core. Like we preach all the time. You can come over. We're going to do your blood work. You might not be eligible for testosterone replacement. It ain't going to be for everybody, right? But what we are seeing is 20-something-year-old young men, 30-year-old young men that are coming in with estrogen levels sky high. It's the foods. It wasn't like that back in our day, but now we're seeing women with crazy estrogen levels, right? And, 10-year-old, I call them little, not children, but 10-year-old girls, 11-year-old girls, they're already getting developed.
Yeah.
Right? I got a grandbaby that's 17, and I watched that happen. It's from the food. So that's what changed, right? All of us old guys go, hey, them girls didn't look like that in our junior high and high school, right? Well, nothing's different. We still create the same way, right? But it's the hormones in the food. So it's just throwing everything upside down these days. So very important what I tell everybody. We used to say back in the day, you're going to get your hormones checked, you better be over 40 if you're going to see a problem, pituitary gland.
Back when I started this company 15 years ago, this October, we didn't treat anyone under the age of 30. And now we're seeing men, now that we know that testosterone doesn't make it so you can't have children anymore, because that's a fable.
That myth.
That's a myth. We have protocols put in place. I've had 2 kids on testosterone. Changing protocol, lowering dose of testosterone, increasing dose of HCG, incorporating clomiphene or N-clomiphene, and you have a winner here.
Yeah.
And there's hundreds of patients that have gone to fertility doctors that came to Core and have been taken off TRT.
Yep.
And I'm going to tell you something. There's 2 things that go on there. Number 1, you lose your sex drive. Number 1, you lose the quality of your erection, and you have no drive.
Yeah.
Right?
Yeah.
Number 2, let's slow down and think about this. If you have to go on to a major fertility program with a fertility doctor, how much money does that cost?
Oh, it's big money.
It's huge money.
Yeah.
It costs almost 0.0001% to go on of that dollar amount to take a high level of HCG, lower your dose of testosterone, and get someone pregnant. There's a method behind their madness.
Yeah, of course.
And I'll tell you right now, it is, I see it more and more. Nick Kay went through it.
Yeah.
And he was like, dude, I wish I met you before this. It cost him $27,000. It's crazy. And there are so many men that have came off testosterone, tried their fertility with their doctor, couldn't make it happen, came to us, we put them on our fertility program.
Yeah.
Bang. They're like, I cannot believe I just went through. It's
surprising, and it ain't surprising me when they take you off the testosterone and do this. You said, big pharma. Let's jack them full of HCG. We're going to take them off the testosterone. The protocol ain't working the first time. The husband and wife are getting a little, discouraged. Let's try round 2. I know people that went through 3 rounds of that and did exactly what Nick Hay did and got with somebody that was smart. Not even, people didn't reach out to a company or a good guy like a Dave Palumbo who knows, the body and stuff, and was like, worst thing they did was take you off that little bit of testosterone.
Well, the other side of it too is, let's just really dig deep on this. A lot of people watching this podcast most likely have come off their testosterone. Mm-hmm. How's their demeanor?
Yeah.
What's their household look like?
Yeah.
I mean, when I come off testosterone, I have like a quarter of the drive that I have today.
Yeah.
I'm not engaging with my wife. I'm not engaging with my children. And, women want to be desired.
Yep.
And in return, they treat their man better.
Yeah.
And if they're not desired, sex life typically goes down the tubes. Yeah. And coming off testosterone puts you into that category.
It's funny because, we say that's our protocol forever, guys. I am 55, you're being 46. 6.5 years ago when I got the stent, I did come off my testosterone protocol because I just wanted to make sure when we got with the cardiologist, what he was going to say. He's a dear friend of mine, right? We found the blockage. He did the stent. So I'm off for 3 weeks prior to the stent, 4 weeks after stent, so 7 weeks. Doc wants some blood work, so I do it through us, right? I give all the hormones and everything. I go in his office and he's looking at this. He goes, Mel, I thought your partner's in a hormone company. I said, I am. He goes, why is your overall testosterone 200? I said, because I've been off everything. So that's me, just natural, 200. He goes, boy, you convert your estrogen. My estrogen was in the 80s. And, of course, testicles shut down, right? And he goes, why'd you stop? And I go, well, Doc, I didn't know how you were going to. I wanted to see what you said about it. He goes, I have no problem with you taking testosterone replacement and getting to a level of 700-800
Your
out
heart's
of a
a muscle.
950. Heart's a muscle.
It gets atrophy if your body's not producing testosterone.
And most doctors, we say, don't know the hormones, but this my cardiologist did, and he goes, and boy, that estrogen, bro, prostate, everything like that. I go, right. I stopped my protocol. And the way I felt for them 7 weeks, or let's go 5 weeks, because I probably didn't feel it the first week or so, but when you crash like that, I keep my levels in the 800s. When you crash like that, man, I didn't have no drive for anything.
The other side, and I want to get into a stigma also behind testosterone in a second about how people are worried about if they're aggressive and they're going on testosterone. I want to talk about that in a second. But before that, I just want to back up here real quick. So the other thing that I saw at this event was, and I do it at every one, I get up and I speak. I say, hey guys, raise your hand if you know what your testosterone is. Half the room raises their hand. Great. What's your testosterone? I pick one person. 700. All right, that's your total. What's your free? What's free testosterone?
Yeah.
Right? And we get blood work every day with free testosterone not even checked.
Yeah.
Sex, not even checked, right? So total testosterone is great to have. You need that number 7, 8, 900.
Yeah.
But what you really need to know about is your free testosterone. Like nothing, people brag, oh, my testosterone's 700, I'm good. Well, if your free's 11, your bioavailable is shot, and that's what your body's using too.
I tell it like this, guys. If you have a overall testosterone, I'm just going to pick the number 1,000. You're amazing, right? That's your overall testosterone. But as Sidney said here, your free testosterone's 6, 7, 8. That means it's not converting in the body. So that 1,000 is not being able to be spent in the bloodstream. It's like this. If your wife and you have $100,000 in the bank, but she only lets you have access to 10, the other 90 is not doing you no good. So it's not doing you no good. If it's not converting into the bloodstream, it's not there for use right now for use. That's just holding it there. You're not converting. We go and check the sex globulin binding hormone. And if that's, you see me, once in a while I get low on the free testosterone. I'm not, and everything converts in the liver. So maybe, your liver's, what they call it, a little sluggish. I hate to say fatty because people are like, I'm not fat, but the filters need some cleaning, right? And then the medication we give unbinds the testosterone.
So the way that I've been explaining it too is if anyone's ever had a dirt bike or a four-wheeler, they know what a reserve tank is versus the gas tank.
Yeah.
Right?
Yeah.
Your total testosterone is your reserve tank. Your free testosterone is your gas tank.
Mm-hmm.
That reserve tank is holding your testosterone for conversion from your free testosterone. When that testosterone, which is a protein, goes to bind onto cells after it goes through the entire body, is processed, it goes to bind onto those cells. If your sex hormone binding globulin is clogged, and it's a dry sponge in the sink, hasn't had water in days, right? That protein cannot bind to the cell and absorb and turn into a free testosterone.
Yep.
So your bioavailable, your free testosterone, guys, is something you need to look at. If you're not using Core Medical Group, at least call when you're going to go see your GP and get put on TRT and have them do our entire panel. And you can call us too and be like, am I being treated properly here? Is this the right protocol? We do it all the time. Because the reality of it is that, like, we don't want you to move from your GP, if you're comfortable, just to get anostrozole if you need it, or just to get danazol if you need it.
Yeah,
Go
yeah.
back to your GP
Tell 'em.
and tell them. Right? The reality of it is we have more people coming aboard than we know what to do with, and it doesn't hurt us to help them.
No, and I can't tell you how many times, I'm going to speak for myself. I know we all do it, but how many times I get DMs and I'm helping a person out because they're doing it through their doctor. He might take oh, I only paid $10. He does this insurance thing. I go, right, but you're reaching out to me because, right, you're not feeling right. He goes, no. What's he doing you? If the doctor somewhat knows what he's doing, he's giving him a CC, once a week. If the doctor completely doesn't know what he's doing, he's giving him a CC every 2 weeks, which crashes that. The estrogen's converting. It's going. You're just playing, roller coaster with the hormones. Now they feel horrible.
Or what I saw at this event was a gentleman that was on 1 cc a test for 10 weeks and said he didn't feel anything. The same guy that I was talking about before, and the doctor gave him another cc a week.
Wow.
So, obviously the estrogen conversion, the whole 9 yards, not good, right? So get with a specialist, speak with one of our any of our staff can kind of guide you, but we have a lot of knowledge on the medical side of Core Medical Group. We have 3 chief of medicines and 13 NPs and PAs that are all super knowledgeable.
Yes.
And the reality of it is that if you're taking testosterone, learn how to take it properly. And going into the next thing, I'm going to say right now, within Core's circle, we have probably some of the most aggressive superheroes walking the face of the earth.
So true.
That between all of our operators, all of our pro athletes, even our celebrities that are just absolute studs.
Yes.
We have ultra marathon runners. We have guys that have had troubled pasts that are super aggressive, right?
Yeah, yeah.
And we get a lot of the time, oh, my wife doesn't want me on this because I have a bad temper. Well, you know what? That testosterone is not going to make that temper worse. Not having proper testosterone will make that temper a lot worse. So that's another stigma that needs to be addressed. A low dose of testosterone getting you to an optimal range will help with that aggression.
100%. And look what you're saying. They don't know where that estrogen's laying at. So if you have that higher estrogen level and that testosterone's middle of the road or less, the estrogen's going to make you miserable.
Yeah.
I mean, I was very, very crabby with my overall being 200. My free was plummeted. And like I said, my estrogen was in the 80s or even 90 that time. We were like shocked by it. And I was just miserable. My little Mel was like, you're snappy at everything. And so we proved that fact. It's not the testosterone. I get on the testosterone, I run in the 800s. I feel amazing.
And the other side of it too is, let's just not talk about men. Let's talk about females real quick.
Yeah.
All right. Females, you guys need testosterone too. You also need to make sure that estrogen level is dialed in properly, especially as you get older. Once you're done having children, especially dialing in and getting a good protocol for TRT. 50% of our patients that are on board with their spouse.
Yeah, it's crazy.
50%.
Right? It's so cool to see that.
So 5 years ago, we were a 90-10 ratio. We're a 70-30 ratio now.
And the women.
We have 2 specialists that's all they really work on at Core, Betsy, Brianna.
Yeah.
They're unbelievable with those protocols. So for the females out there, my wife takes 1 shot of testosterone a week. Sometimes she breaks up. She puts in a little teeny insulin syringe, pokes herself in the butt, and she's good for the week, right? She doesn't have to worry about putting the cream on.
Yeah.
She gets her conversion.
Yeah.
Her estrogen's fine. Doesn't need to be on progesterone or bias yet, right?
Yeah.
But she feels amazing.
Yeah.
So women out there that are dragging and are exhausted and that are gaining weight, guys, that small little dose of testosterone to get you in range is a game changer. If your husband is on testosterone and chasing you around the house and you do not have desire, call us.
Yeah.
We'll fix that.
And it's so I'll use my wife, Melissa, little Mel, we call her. She's just turned 46, but she's been on the protocol with us now probably for about 4 good years. Went through an early menopause. We don't have any children together, so that kind of does it, speeds it up a little bit. And so she had to. Her testosterone was at the very low end of the range, you guys. It was in the range, but at the bottom of the range, right? And her estrogen, of course, was low, and she had to go on progesterone because that's the hormone for women. As they get a little older, she was having the night sweats, losing some hair as she was combing. She got that long hair, thick hair, losing the hair, lack of libido, the whole 9 yards. So when she got on that protocol, for her, it's dialing that progesterone in for her.
And another good explanation is that we've all, older men have all dealt with a female in their life, whether it's a sister, a mother, a wife, a loved one, a friend, that has a very difficult time before their period, right?
Yeah. Oh, yeah.
Right? And you can see that mood change. And I used to mark it on my calendar with my ex. I was like, all right, I'm going hunting this week.
Yeah.
And that is because their hormones are changing dramatically prior to them menstruating.
Mm-hmm.
So guys out there, it is almost the same exact thing. If you're getting mood swings and you don't have a consistent demeanor, it's very important that you guys are analyzing your estrogen. And with taking testosterone, it's just part of the equation. So, a male and female work very different, but we still need the same things.
Absolutely. It's like I say, they have 3 hormones that need to be really watched and checked: testosterone, estrogen, progesterone. And we have the 3 hormones: testosterone and anti-estrogen, and FSH and LH in our testicles. Mm-hmm. It's like the same thing, 3 and 3. Mm-hmm. We need them balanced, So very important. And it's very cool that you said that because, we are seeing so many people on board. I've, for the 6.5 years that I've been Sid's partner, and for, up until maybe a year and a half ago, I talked to every single patient that came in. I heard their wives in the background. We always have a funny thing, and the wife will say, because they're on speakerphone, "Hey, Mel, I don't want my husband on steroids." And I go, "Yeah, either do we."
Exactly. I know. I use that all the time.
Yeah, either do we. And they go, "What?" And I go, "Testosterone's a hormone. That's why they test for it. You don't see any tests for DECAs, and you don't see any tests for anadrol and stuff like that." And she goes, I go, "That's anabolic steroids." And she goes, "Oh."
Yeah, you can't find that in the blood work.
Yeah, you can't find that
we can tell when you're on it, guys.
Yeah, we can tell when you're on it by all the levels. But then they understand it. People are they're just naive because they don't understand what the hormones are, right? So it's cool to see. And then all of a sudden they're like, "Do you guys treat women?" "Oh, absolutely. You guys got the hormones too, but this is what my wife takes. This is what the symptom she was." And the women are like, "Exactly what I'm going through."
And the other side of it too, guys, we do a very good job of getting ahead of it at Core because of the amount of blood work we do, the amount of times you're required to get that blood work done, and the amount of touch points we have with our patient coordinators and physicians to understand how you feel. For those of you out there that have been on testosterone, whether it's with us or somebody else, okay, and all of a sudden, from 1 month to the next, you just feel like it's starting to it just doesn't feel the same, right? Yeah. The 80% of the time that happens. It's not because you need more testosterone.
Correct.
Some of the times it's because your estrogen's gone up. Maybe we need to go from 0.25 milligrams to 0.5 a week to, whatever. Yeah. There's no reason why anybody right now should be taking 2 milligrams of anostrozole unless you're in that 1%, because suppressed estrogen is really bad. But guys, something else just to keep in mind: if you are not feeling the positive effects of testosterone like you did in the beginning, it is mostly because your sex hormone binding globulins are clogged. And to fix that, we use a drug called danazol. Danazol now opens those receptors up and allows that testosterone now to bind. It's a real easy, inexpensive fix. So if you feel like you're on testosterone and going through the motions again, and you're not really feeling it, that's probably what it is.
It's always what it is. And the normal doctor that doesn't understand that is going to do what you talked about and give you a little more testosterone, which is going to go to convert to estrogen and keep clogging it up.
Or take you off testosterone for a period of time and then put you back on. Yeah.
Put you back on. That's the part where I tell all these guys, if you're not doing the supportive meds, checking the blood work to see what's going on with them levels, and you're doing yourself an injustice, guys. I mean, really, you are. I know a lot of guys go, "I'm cool with my 1 cc of testosterone my doctor gives me." If you're cool and you feel good, there's no reason to talk to us. But you're not. If you're reaching out to one of us here, you don't feel good. You're not calling it. I'm dear friends with my dentist. I talk to him, but I'm not calling him and saying, "Hey, Doc Rowe, I got to get in your chair." Why? I don't know. I just want to come there and hang out in your chair. Shoot me up. Something's wrong with my tooth.
Well, the other side of it too is, guys, just because you feel good, you need to take your surroundings into consideration, right? You might feel great, but like how what is your demeanor like? Are you arguing with people a lot?
Yeah.
Are you having a hard time waking up in the morning on testosterone? There should be no reason why you're not ready to go in the morning.
And this is it, men, prostate. I'm gonna preach this and say it, and we do in every podcast. We have to watch our prostate levels, right? And as we get older, of course, we see that, we get that a little bit enlarged prostate. You can feel great. You're not getting your PSA checked, or your estrogen is sky high and you don't know it. That's a problem with your prostate.
Exactly.
Right? A lot of doctors put guys on the 5 milligram daily dose of Cialis, right? Because it's a vasodilator, which means it relaxes the arteries and stuff, which opens up the flow for the prostate and everything like that. So
consistent blood flow throughout the entire body, especially
Yes.
to like the fingers,
Yes.
the feet, the limbs in your body, and your penis is a limb.
Absolutely.
So that small dose is fantastic. It's not just used for sex drive. We have a lot of guys like, oh, I'm fine in that department.
Yeah.
Okay, great. Well, we're more worried about your overall health, and that's fantastic.
Yeah.
That 5 milligrams isn't going to change anything, but it's amazing. I do it.
Me too.
I purchase our trochees. I cut them in
Yes.
4s, and
Yes.
it's a game changer, and it's a game changer to be proactive for your prostate.
Well, when I had the kidney stone, thank God, the kidney stone a few years back, right? And I was mangled, right? And I go into there, and they do
Mel
the
being
X-ray.
sick is not good, guys. He's like a 3-year-old that you're telling to blow their nose, and they can't do it.
People were like, "Hey, are you that tough dude who pain?" And I tell them, "Absolutely not, man. I stubbed my fingernail the wrong way, and I'm so that was brutal." And then my physical doctor said to me, "Mel, you should take a 5 milligram daily dose of Cialis, every morning." And I go, just like that, I go, "Doc, I'm cool there." And he goes, No, I'm not doing it for you, cool. I know your hormones are good, but this is what it's going to do for you. And you go into the gym and you get the great pump because it's a vasodilator. You're going to get a good pump. The blood flow is going to be over. And he goes, "And you're borderline on your blood pressure." I said, "Yeah, I'm like right there." He goes, "And me and you don't like to do any kind of meds?" I go, "No, because I do all the cardio and keep it down." He goes, "Watch, this is going to drop it a little bit." And boy, was he right.
Yeah, it works.
Drop that blood pressure a little bit. I drink a lot of fluid all day, so I'm still up once, maybe twice a night, because I'm drinking fluid till I go to bed. I don't care about getting up and peeing. But before I was doing it, you guys, it was 3 times, maybe 4 times with all the fluid I drink.
Really?
This cut 1 or 2 of the trips to the bathroom down.
So, next note, because we're not going to make this one a long one for you guys, but next note, Core Medical as an ongoing effort to be the leaders in the industry. Hey guys, we might not have the most patients in the industry, right? We might not be the biggest in the industry, but I believe us to be the best, or we wouldn't have the type of patients that we have.
Yes, and the people that believe in us, who are our patients, who are our ambassadors, who are Core Medical.
Exactly.
True.
I mean, it's just, you don't have a guy like Nick K, Cody, Rocco, Mel, that have other big businesses that are doing big things, put their name on something to risk their real bread and butter, right? And then you don't have patients that are calling in constantly, thanking us so much, comparing us to their last interaction with the clinics that they were at before. Yeah. You don't have retention of losing 10 to 20% of our patients and then seeing them back in circulation within 10 to 20 weeks later because they left because of price.
Right,
exactly. They left because of price. And once they get there, they realize, wow, I'm not getting any of the service and not even all the meds. I just left because someone's offering a bottle of testosterone for $99. But guess what, guys? It's a 5 ml vial and you're not getting any supporting meds. And by the time it's all said and done, it just costs you way more. Have the humility to come back, guys.
Yeah.
And if you also are in a price jam, call me, DM me directly. My phone number's available. We will help you. Do not leave us because of pricing.
Yeah. Said you hats off, because when COVID hit and we were, people were, down and laid off from their jobs and everything that we went through, the patients were calling me up.
$270,000.
Is that what it was?
That we donated back to the community.
And Sid made this thing and told us all that we were with the patients. Listen, they can't afford it right now. We're going to put them on a credit. And I'm knocking the price down through COVID right now, and they're building up a credit with us. So when the people got their jobs back and everything, they were amazed. They were like, "What?" I said, "Yeah, that came from Sidney. That was his idea. We're all going through some tough times," and they loved it. And I was going to say this, myself.
Gave it like 300 free 20-week protocols.
Yeah, it was amazing what you did here for the company. Just myself, guys like Nick K, Rocco Vargas, big following and stuff. I can't tell you how many different hormone companies call us. Hey, man, I was just wondering if maybe I could talk to you. Maybe I could offer you more money. Maybe you're unhappy over there. We all say the same thing. We're very good where we're at because I know when I hand off a patient who becomes my friend. Yeah, true that. I was. And I know when I hand off that patient that I talk to, that I spend time with on the phone, that's going to see me at shows or see me in the appearances. I make a lot of public appearances, right? So I see everybody, right? That they are going to be in good hands. We know we're sticklers, me and you, about that. We make sure that our people are treating them accordingly, taking their calls, making sure they're on top of things. I know a lot of companies right now that people come and say, there's no customers. I can't even.
How about this?
I got my first meds.
It's a freaking finger prick.
Yeah.
For testosterone levels, nothing else. And then here's your stuff.
Yeah.
You can go on their website and place an order for what you want.
Yeah.
There's no protocol.
They don't want to because they don't want to have nobody talking on the phones. They don't want the man.
So there's going to be a link on this site right here so that you guys can click on it below. Okay, Christian, just make sure that this goes down. That you can click on this, and you're going to see what our protocols look like after you go through a process here, a core medical group. What our MDs, NPs, and PAs design for each individual patient and how it works. It's an explanation of line by line of everything that's going on in your blood work. It takes 45 minutes, and then a protocol to match up with your deficiencies and a full explanation of why we are choosing this medication for you.
Yep.
You don't have to purchase all of it. If it's, we actually suggest when you come aboard that you start off with just basic TRT.
Yep, we do.
Right?
Yeah.
And then let that magic happen. On that note, as everyone knows, between state licensing, between how hard it's been for us as a team to stay licensed in all of these states, okay, to stay above board in all of these states, make sure the people that you're working with are licensed in the state that you're in, number one. And if you're trying to find a reputable company, don't look at what they're posting. Look at the type of people that are following them. Look at those people. See what type of quality community that they've built around their hormone clinic. Yeah. Because that's a very important thing.
Yeah.
Like,
that's a good.
I mean, the reality is I can post some amazing stuff on social media. I can be whoever I want.
Yeah.
But, do I have a bunch of guys that are just juiced out of their mind that are following me? Right? That's probably not a long-term healthy decision for your health. And look at that stuff. And then also when you call a clinic and they're like telling you what you can get on that first phone call, hang the fucking phone up.
Yeah.
Because they haven't seen your blood work, right? Like
Amen.
You can have goals, you can explain the goals, you can understand the process, but until that blood work comes back, we know nothing. I call it mental masturbation. We know nothing at all. So going into really why we started this podcast today,
cool.
Okay? Between the licensing, that was one thing that it's an ongoing effort, very difficult, right? The harder thing is to have some of these amazing peptides that do amazing things for our body, that are secretagogues, that are not synthetic, that cause our bodies just to be able to produce more cells, increase our collagen levels, help us sleep better, cell regeneration drugs, things of that nature that are not controlled substance. They're trying to get rid of them.
Yes.
Right?
Yeah.
And I have worked my tail off along with my staff to keep them around, and I've found a lot of ways to do that legally. Okay, these peptide companies out there that you're buying online from for cheap money, these underground peptide companies that the peptides labeled not for human consumption. Right? It says it right on their website. Okay, those drugs are not batch tested and sterility tested. For the few dollars that you're saving, make sure that you're getting a real peptide. Right? And I mean, you're basically buying illegal drugs, right?
And there's no way for anybody off the street to know because they don't have access to go get it tested like we do at the pharmacies.
There could be anything inside there.
Anything.
And the liability is on you because you're going to try to save a few dollars, especially if you're older and established. It blows my mind. Our bodies are not as resilient as they were when we were in our early 20s. You're not getting any, if you're obviously not buying underground and getting your blood work tested, right? So let's just say you go and you purchase, Testosterone or something else, and maybe you do have an issue with some type of cancer inside your body, okay? And that hasn't been analyzed. Or maybe your enzymes are elevated and you start taking MK677.
Yeah.
And now you're causing major issues to your body.
Yeah.
So without having proper protocols in place and purchasing these medications from these underground peptide companies, it's ridiculous. So Core has done a great job of keeping around the majority of the peptides. And there's one specific that Mel, before this is over, is going to talk deeply about. And guys, pay very close attention to this because it's very important. In the way that we found out how amazing this peptide is because Mel dove deep on it personally himself and took initiative to understand how it worked and the benefits of it.
BPC 157, guys. So one of our doctors here, Dr. Marasco, 20-something-year friend of mine, who really understands the peptides deeply. So about a year and a half ago, I went through, I don't know if you guys could be, oh yeah, you could see it, look at it on the screen. Upper bicep tear there. Upper bicep tear there. My shoulders are tore up, guys, from all that years of heavy lifting. The two tendons, supraspinatus, infraspinatus, were both tore 10, 12 years ago. They're amazed that I can do this. But I get the pain in it and stuff. So about a year and a half ago, Dr. Brent says to me, Mel, get on some BPC 157. I go, yeah, my own patients tell me that. They tell me how good it works for me and stuff. I go, I'm like not even, I'm the choir, I'm preaching to the choir, I guess.
Do as I say, not as I do.
Yeah. So anyways, I said, okay, let me quit being lazy and get some BPC. He said, take it every day at the dose it says every day. Go from your shoulder to your shoulder because you know the bad shoulders. He goes, I know you your knee bothers you sometimes. And they say, guys, you could put it to where you have the problem. If you had a golfer's elbow, you can
spot and check.
You can spot and check.
It's not 100% necessary if you're not comfortable, but it can bring some added value.
Yeah, they say it gets there first, saturates that spot first, and then goes through the body. If you're not 100% comfortable, you could just put it inside your shoulder, your butt, wherever you want to do it, right? And still do that, right? Didn't do the same. But I said, okay, Brent, I'm going to do this, right? So shoulder to shoulder, I'm taking it once a day. I tore this, a few months ago? Yeah. A few months ago, right? And I doubled it up, for a few weeks. I was taking it once in the morning, once at night, which he told me to do. So anyways, a year and a half.
It's pure collagen, guys. You can't really overdose on it, but a good dose is about 50 units a day on a half-inch insulin syringe.
Yeah, right in the spot. It's easy, right? So not just listening to Dr. Brent and doing it, and I'm like, man, I'm not as stiff. This stuff's working for me. I feel it. One time, bad tennis elbow. Couldn't even put my elbow down on the table. It was horrible. Them things come out of the blue, as you know, right? So I spot injected it right in the elbow. I put a little clip, like a baggy Dorito clip there, and stuck it right in the skin, right? 2 weeks later, that thing was completely gone. I'm telling Dr. Brent, boy, I love this stuff. It's why I was kind of frantic when they were talking about Big Pharma wanted to get rid of it, right? Because it works, right? So you had to do your magic and get us in there. So now here comes something that I didn't know about. Dr. Brent says it's an amazing anti-inflammatory. Okay, so that's great. So once a year, guys, I get something checked called C-reactive protein, and that shows you the inflammation in your body, okay? The year prior, I only do that once a year. I get blood tests done 3 times a year, but the C-reactive protein, all my doctors told me, you just need that once a year.
We now offer it as an add-on at Core Medical. You just ask your patient coordinator.
Yes. C-reactive protein shows the inflammation in the body, and you could talk to your patient coordinator. They'll add it on. Okay, so now, 2 months ago, I said, you know what, Brandon, I need put the C-reactive protein on my test. I'm going in to get the blood work done. I check that every year, right? The range is from 1 to 10, 10 being the highest. You're inflamed, okay?
That inflammation can come from a lot of different things. Come from alcohol abuse, smoking, being around areas of being a mechanic, being in any area where there's types of fumes, firefighters, heavy C-reactive protein, guys. If you are a firefighter, very important that you guys are getting that tested. Anything that can cause anything in the world that you can think of, what was amazing? I just saw a toll booth attendant we just had come aboard at Core, breathing in all that all day long, breathing that in. Yep.
How about this? The foods. I mean, I'm a sweet dude. I'm a sweet guy, but I love sweets. I love sweets. I'm a chip dude. Me and little Mel love the saltiness.
All my M&Ms are gone in my house.
The M&Ms and stuff. Inflammation. Your body, your body doesn't use something and it's turning into the fats the way it is, it inflames your body. You said it great. Anything can inflame the body, right? So anyways, I've always been at a 7, at an 8. I've seen it one time where it was 9, and I was like, man, I better figure out what's inflaming my body here, And so now, last year's...
You haven't changed any habits?
Haven't changed any habit. I still do some stuff to inflame my body. Like I said, I'll have a drink here and there. I don't eat clean all the time. I'm eating some things. I don't smoke, do anything else. But there's a lot of things, like we said. It could be anything. So last year, I'm at an 8. Okay? So Brandon, give me my test. I get the results back. I'm going down my blood work, and I look at my C-reactive protein, because it's always at the bottom, and I'm 1. I'm at a 1, and I go, holy cow. I FaceTime Dr. Brent. I go, bro, I got to show you something. Show him on the thing. And he goes, wow, Mel. He goes, what? You kind of were always in the middle of the road. I go, middle of the road? I've just been an 8 and 9. And he goes, that's amazing. I go, I switched nothing. I still have a Jack and Coke. I still eat Doritos. I still eat peanut butter and jellies. Nothing changed in my life except this BPC protocol.
Yep.
And I called you up immediately, and I was like, Sid, I'm blown away right now.
Yeah. So, I mean, it's very, very, very important, guys. Especially as we get older, we start to dig deeper. It's probably going to be something we'll just probably permanently just add to our blood work here shortly.
Yeah.
But another thing before we wrap up, for our operators out there, people that have been in burn pits, firefighters, they'll come back from these deployments and their bodies just hurt tremendously. They're full of just these toxic chemicals. If you want to dig real deep, okay, guys, and you really want to get that cleanse through your body, the BPC is great. If you have the means, I stay on it all year round. If you don't, 2 or 3 times a year is great. But guys, incorporate glutathione with it. Game changer. So now you have this super antioxidant now with the BPC, with that pure collagen, and it is just basically draining everything out of your body that is not necessary. Just think about as we get older, right? When we're younger, just like anything else, that's a fresh body. As we get older, we're just enduring trauma from our foods, from our jobs, from everything, and our intake, breathing, all that stuff. That's what ages us.
Got a great glutathione story. It's going to be for the older people because they're going to have to know who this is. The mother of all antioxidants, glutathione, the mother of all antioxidants. Dick Clark, who only the old people are going to know, right? Who lived, he looked like he was 40 when he was 80, right?
And I believe he smoked.
He smoked. Dick Clark was a smoker. He inflamed, right? He used to go to the hospital because he was Dick Clark, and they would give him a glutathione bag before the pharmacies were doing any of this with the peptides.
Yeah, they'd push it for him.
They'd push him in the glutathione. He was so big, he did so much research on it that he was a huge fan of glutathione back in the day, before there was even hormone companies. Let's be honest. Dick Clark was, lived forever. And my dad used to say, he never ages, this guy. He looks great. He's this and that. And then finally, later, I find out that that's what he was doing. So I run the glutathione personally twice a year.
Yep.
A few months into the year, because it's a 30-day protocol, and then I don't take it for the rest of the months, and then I run it towards that end of the season.
So you guys, there's 2 choices with that glutathione. You get a 30 ml vial. I suggest when you get the vial, sit down, preload your syringes for the week, stay consistent for 30 days, and it's a shot every day for 30 days with an insulin syringe. You can go anywhere in your body with it, doesn't matter. And or if you're by one of our clinics or have the means, you can do a push. You take a 10 ml syringe. At the clinic, we add a little bit of sterile water to it so it dilutes it, because you do get queasy when it's a push. And we push that slowly into your veins. And you can do that, 2 or 3 times in a row every other week, and you get that full cleanse. So either way you want to go about it, it works almost the exact same.
Yeah.
Incorporation with that BPC 157, guys, an absolute game changer. Inflammation equals soreness. It equals being lethargic.
Yep.
And these are things that are super important to understand. So guys, that's really what we had to cover today, Mel.
Absolutely.
Are you good there?
I'm good. I just want to tell everybody, when you become a patient for Core Medical and after the doctors see all that extensive blood work, you are eligible for the certain peptides. The doctor's going to say that, if he's going to see something high, he's going to recommend it. And, I can, like we just said, specifically speak on how great that BPC, what it did for me, and to not even know that it was going to do that to the C-reactive protein that much. And then the glutathione push. Two ones I'm a big fan of right there.
The biggest thing you're going to see with that, the glutathione, is the liver enzymes are going to drop.
So in the bodybuilding world, when guys are competing, orals are very necessary, especially when you're getting ready for a show. The Anavirus, the halotestins, because it's peeling you up, right? So you have to do it if you want to be at that level. I've seen guys come and say, "Hey, man, I just got some blood work done, and my ALT and AST are in the hundreds, which is, the
Terrible.
top of the range is 44. They're in the hundreds. You guys know it's the orals, right? Yeah, but we can't go off. I get it. I've been there and stuff like that. You get some glutathione. Wherever you got to get some real glutathione from, get some real glutathione. They'll get real glutathione. Do that. Didn't quit taking the orals. Do that 30-day, 1 cc every day and everything like that. Go get your blood test. And I watched that cut it in half.
Yeah.
While they were still taking the orals.
And you guys, there's just one more basic thing. There's a lot of products out there that are oral glutathione, powder glutathione. Don't waste your money.
Don't waste your money.
So
it has to be done just like that.
I just want to celebrate how knowledgeable that we are.
It's amazing.
Yeah.
It's so cool because people say to me on the phone, like, "Hey, Mel, we know your past, right? And the biker stuff and everything like that. Man, you should have been a doctor, Mel." And I'm like, well, one thing, when I was younger, I worked with a doctor, and I wanted to know why when I was putting this DECA in me and I was putting this test and these other things in me, I wanted to know how they worked in the body and why I was taking them. I just wasn't that dude. Like, I might have been a maniac in the 1%er world, but I'm not sticking anything in me just because the dude next to me tells me it works.
Exactly.
I wanted to live a long, healthy life as much as I could. So I did a lot of research, and I had a great doctor that cared about me back in the day when there was no hormone clinics. You weren't the insurance company. You're testing this 25-year-old kid's testosterone level. Yeah, make them pay cash.
In closing, guys, don't get too comfortable with your insurance companies covering your testosterone for too much longer.
Yeah, true.
It's on the chopping block, and supporting meds are very important to get, guys. Please, 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 if anything else, call us and we'll educate you. You do not need to spend a penny. Or at the very least, come in, do the onboarding process, get our very thorough blood work done, which you can take to anywhere. I've never seen anyone come to me with more blood work than we do. You can go through what's included with that is an entire telehealth visit, all included in that price. And if you don't like it, you want a second opinion, take that information, go somewhere else. There's zero hard feelings, zero.
Right.
So guys, we wish you all the best health. And I hope this was very, very educational. And Mel, thanks for being just the best all around.
Of course. And listen, I want to end like this. You guys DM me. You guys all know me. I get back to everybody. Any questions you have about the hormones, about your health, about the blood work, DM me, and I'm gonna answer that call. Believe me.
Thanks, guys, so much. Best wishes.